Welcome to this explainer. If you or someone you love is navigating the world of fertility treatments right now, you already know it can feel a bit like trying to learn a completely new language, all while riding an absolute emotional roller coaster. It's a lot. So our goal today is to make that journey feel just a little bit less overwhelming. We're going to bring some much-needed clarity to one specific, highly talked-about test in the fertility world, taking it step by step so you can feel informed, grounded, and most importantly, empowered.
We absolutely have to acknowledge right out of the gate the immense emotional weight that comes with fertility care. There are just so many decisions to make, and often it feels like so much is completely out of your control, right? But knowledge truly is power. Today, we're looking at a specific tool that fertility specialists use to bring a deeper level of understanding and ultimately hope to the IVF process. We're going to explore how looking really closely at the genetic health of an embryo might just be the guiding light you need. Let's figure this out together.
All right, Section 1. Welcome to PGT-A.
Okay, let's demystify a term you've probably seen on clinic brochures or heard tossed around in your doctor's office. We're leaving the intimidating medical jargon at the door today and breaking this down into plain, reassuring terms that actually make sense for your journey. So, the formal definition: PGT-A stands for Preimplantation Genetic Testing for Aneuploidies. You might actually hear some folks or maybe older articles refer to it by its former name, PGS, which is Preimplantation Genetic Screening. But in the simplest terms, this is an extra step used during IVF to help select the very best embryos for transfer. Its main job is to gently sift through the embryos created in the lab to identify the ones with a perfectly normal chromosome count. It filters out the ones with abnormal chromosome copy numbers. And by doing this, the test helps pinpoint the embryos with the absolute highest potential for success.
Now, there's a very specific golden word you're hoping to hear from your care team, and that word is euploid. When you're going through IVF and using PGT-A, it is a wonderfully positive term. It simply means the embryo has a normal chromosome complement. Basically, exactly the right number of chromosomes needed to develop beautifully. Finding these euploid embryos is exactly what we're looking for because it drastically improves the chances of a successful pregnancy.
Moving on to Section 2, looking beyond the surface.
So you might be wondering, well, if the doctors are already looking at the embryos in the lab anyway, why on earth do we need an extra test? Why can't we just pick the ones that look the best? Well, think of it like the old saying, you can't judge a book by its cover. For a long time, embryologists had to rely almost entirely on visual assessment, literally just looking through a microscope at the physical appearance of the embryo. But here's the catch. An embryo can look absolutely picture-perfect on the outside, structurally flawless, while completely hiding chromosomal issues on the inside. PGT-A goes beyond that visual check. It analyzes the actual genetic material to confirm that the chromosome numbers are normal. We're basically making sure the inside matches that beautiful outside.
This right here is a foundational truth in modern fertility care. As the medical sources explicitly state, the normal appearance of an embryo just cannot confirm the absence of a genetic abnormality. Most of the time, it's literally impossible to identify a genetically normal embryo visually just by using a microscope. So, by using PGT-A to verify a normal chromosome copy number, we're finding the embryos that have the real, scientifically backed potential to successfully implant in the uterus, safely reach a full-term pregnancy, and ultimately give you what you want, a healthy baby.
Section 3. Who can benefit most? So who is this actually for? While PGT-A is a remarkable tool, fertility specialists usually recommend it most strongly for specific groups of patients who have faced very unique and frankly often heartbreaking challenges on their path to parenthood. Clinics specifically consider PGT-A for women who fall into one of these four categories. First, those who've endured the pain of a history of recurrent miscarriage. Second, patients who've experienced recurrent implantation failure where beautiful embryos just aren't taking hold. Third, anyone who has had a prior pregnancy affected by a chromosomal abnormality. And fourth, women who are in their mid-30s or older, simply because the natural rate of chromosomal errors in eggs does increase with age. If any of this resonates with your own story, just know this testing is specifically designed to help navigate those exact hurdles.
Let's move to Section 4, step by step, the process.
It's totally normal to feel a bit protective of your embryos, right? And to wonder exactly what happens to them during this testing. We really want to demystify this medical procedure. It's a highly orderly, predictable, and incredibly delicate process. Now, before any testing can even begin, the embryo has to reach an absolutely incredible milestone. It needs to grow in the laboratory culture for about 5 days to become what's known as a blastocyst. A blastocyst is basically a robust 5-day-old embryo that is beautifully divided and is miraculously now made up of hundreds of cells. The embryo actually must safely reach this strong developmental stage before the clinic will even attempt a biopsy.
The precision of this timeline is just incredible. Step 1 is allowing the embryo to grow to that day 5 blastocyst stage. Step 2 is the biopsy itself. The embryologist carefully removes just 5 to 7 cells. But here's the really reassuring part. They only take these cells from the external layer of the embryo, called the trophectoderm. That's the part that eventually forms the placenta. They do not touch the inner cell mass that actually gives rise to the fetus. Step 3 is sending that tiny sample off to analyze the genetic material. And finally, step 4, the embryos are immediately cryopreserved, safely frozen, right after the biopsy. Once those PGT-A results come back, the suitable euploid embryos are thawed and transferred to the uterus in a subsequent, carefully timed cycle.
If you're feeling worried about the safety of those precious embryos, please hear this directly from the medical sources. PGT-A is a safe procedure. When the process is handled correctly by a skillful, highly trained embryologist, the embryo continues to develop absolutely normally, even after that tiny biopsy is taken. Your future family is in expert hands, and the integrity of the embryo is fiercely protected.
Almost done here, Section 5, Safety and Clear Expectations.
As we start to wrap up our journey today, we do need to set a few boundaries. To feel truly grounded and informed as a patient, it's just as important to know what a test cannot do as it is to know what it can do. Setting clear, realistic expectations is so vital for your peace of mind. And this brings up one of the most natural, common questions patients ask their doctors. If I do PGT-A, does that mean my baby is cleared of absolutely all genetic diseases? It's a great question, and really understanding the scope of this screening is essential.
The straightforward answer is no. It doesn't screen for every single genetic disease in existence. PGT-A testing is specifically designed to assess changes in the number of chromosomes. It looks for numerical changes as well as major structural imbalances in the genetic material, specifically deletions, where a part of a chromosome is missing, and duplications, where a part of the chromosome is doubled. So it's a super powerful tool for catching these major chromosomal imbalances, which are the primary drivers of implantation failure and miscarriage. But it's not a blanket test for all inherited genetic conditions.
Look, navigating fertility treatments requires immense courage, but you don't have to walk in the dark. By understanding how PGT-A works to identify euploid embryos with the right number of chromosomes, you now hold a crucial piece of the puzzle. It might not be for everyone, but for many, it provides the exact clarity and reassurance needed to confidently move forward. So if you found yourself relating to the patient groups we talked about earlier, could this be the missing piece in your own IVF journey? I highly encourage you to take this knowledge, feel confident in what you've learned today, and have an open, empowered conversation with your fertility specialist. Thank you so much for joining me for this explainer, and I wish you absolutely nothing but hope and success on the road ahead.